It's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. The COVID-19 situation here in South Korea continues to remain an issue of concern as daily infections consistently remain above the 100,000 mark.
With surges in cases now apparently halted, the country is now waiting to see a significant drop in numbers. However, authorities have warned that we may yet face another wave this fall. To look deeper into the current situation, we have Seung-taek, Virologist of Zoonotic Virus Lab at Institut Pasteur Korea with us today. Very good morning to you, Dr. Kim. It's lovely to see you again.
Good morning.
Well, first of all, let's talk about the current situation. We know that the case numbers have been showing signs of decline, but just yesterday we passed the 100,000 mark again. So where are we right now in terms of the peak?
Well, I think all the current stats seems to indicate that we have already just reached the peak. And although some the prediction models also just agree that we are actually just some decline just phase. But then we have to actually just, we're actually just kind of just interested in now the increasing number of the severe COVID-19. And then for that, we can think about just a couple of reasons. And number one is that well, especially there's some typical disease progression, just the typical disease progression in the COVID-19. Once a person is tested positive, then there is some time just lag between the confirmation of the COVID-19 and then the starting the manifestation of the severe COVID-19, which is about just 1 or 2 weeks. That's why you are seeing still increasing number of some COVID-19, the severe cases of COVID-19. And then number two is that I think many people are just now just kind of just exhausted this some current COVID-19 just a pandemic, and then as long as they do not just feel any, the substantial, the sick, then some people try to just avoid the some being just tested to basically do not want to just. Their life does not want to be just interrupted by any isolation and things like that. So I think these kind of factors are actually just being reflected in the number of just severe COVID-19 right now.
Right, but real concern, as always, South Korea focuses on critically ill patients. But the country is seeing almost 600 right now, and the government just yesterday said that they expect the number to rise above that part. So how is medical system of South Korea faring?
Well, in the past, we actually already experienced over just 600,000 of confirmed COVID-19 case in the past. But in that case, our healthcare system did not collapse. And we have to actually just reflect the experiences in the past. And then based on those experiences, I think just being prepared is the actually best strategy to just deal with some potential the rise of the severe COVID-19 cases.
And Dr. Kim, now South Korean drug authorities, they've started reviewing Pfizer's new vaccine that offers protection from the Omicron variant. And well, how long will this process take? And shouldn't we really speed things up though before the next expected wave in the fall comes?
Well, in that actually just recently the UK has actually just now just issued some emergency use authorization for so-called some bivalent vaccines. And then I think we don't need to just hurry right now, and we will see the maybe just a sort of a real life experiences in the UK. So I have to talk just a little bit about this updated vaccine. The vaccine that we have used so far is so-called the monovalent vaccine. So this vaccine was actually just designed to express the spike protein of SARS-CoV-2, which was actually just identified in the Wuhan, China, very, very early time. But then, as we know, the virus is actually just evolved and then generate many just the variants. And the problem is that these variants actually does generate the viruses which actually evade our just immune response, which were actually generated by the vaccination. So the Moderna and then Pfizer and the other companies actually have just thought about just developing just sort of just updated vaccines to reflect some currently circulating just the variant. So so this bivalent vaccine is sort of just the first outcome of such efforts. So what Moderna and then Pfizer did that they actually mixed two different vaccines. One is from the sort of just our monovalent just a vaccine that was developed against the ancestral virus. And then the new vaccine that was actually developed for only just the Omicron variant. And recently, just Pfizer actually reported some testing results. And then, as expected, the vaccine actually generated just a higher titer of a neutralizing antibody, especially against the Omicron variant, which is kind of just expected. But then it's like a 1.7-fold increase compared to some monovalent vaccine. But this increased the neutralization antibody titer does not directly just correlate with some clinical efficacy. When actually we look back some 1.5 years ago, when some Pfizer and the Moderna reported their phase 3 clinical trial data, the neutralizing antibody titer was actually twice more with some Moderna just a vaccine, because the Moderna vaccine actually uses 100 microgram of mRNA. However, the Pfizer vaccine used 30 microgram of mRNA. So it's kind of some dose-dependent just response. But then this, twice more neutralizing antibody did not actually directly translate into the clinical efficacy. The clinical efficacy was almost the same between the two vaccines. So we will see some real life experience from the UK, and then anyway the vaccine that we are using right now is still just very good enough.
Right, and as you just mentioned, vaccine we're using right now is still very good enough. And South Korea's domestically developed vaccine is set to be rolled out this week, and this doesn't necessarily include Omicron protection. So how do you see this? Is this going to help with the authorities prepare for the next wave?
Oh, the new Korean vaccine is very similar to the Novavax vaccine that we have already just authorized. And then I think although this is not actually not available for the Omicron variant, but then the vaccine was developed just using the traditional vaccine development process. So I think this might just help just the people who still just hesitate to get vaccinated to. Well, this is kind of just encouraged to just vaccination for those people.
Thank you very much, Dr. Seung-taek. We'll catch up with you very soon.
Okay, thank you.